And you're gonna get into the area that's tender. I don't want you actually like dying of pain. So you can use your hands to determine how much weight you're actually going to apply in the ball. And then once you have a good spot, then you're going to put your weight and then flex and extend your hip. And you do this slowly using your breath. And what you're doing is you're trapping some of the tissues and allowing the muscles to move around the capsule and the ligament. Then you can reposition to a different spot and flex and extend. Do this for about 1 minute. Then what you're going to do is again reposition, and instead of going in a flexion and extension, you're going to externally rotate and abduct your hip. And you may find that as you try and bring your knee across the front line of your body that it feels really tight. But this is excellent because this is going to really release the piriformis, the glute max from the posterior capsule and from the sacrotuberous ligament, so that these muscles for the next exercise are able to turn on and work more effectively. So 1 minute per direction of motion with this ball on your butt, and you're going to be a happy camper. Okay, so now we've released the posterior tissues and we want to turn on our glute max. And I think the best exercise for doing this is a glute bridge. So lie on your back. You've got your pelvis in neutral. Got your feet on the floor. Remember about your metatarsal pressure. You're going to do a kegel, turn on your glutes, and raise up. Hold for 5 seconds, and then slowly lower. Relax, kegel, turn on your glutes, and up you go. Hold for 5 seconds, and back down. Do this 1 to 2 sets, 5 reps for 5 seconds each, and your glutes are going to be happy.
I should go for a run today, but it looks like it could rain.
Save on epic rain jackets at Sierra.
Thing is,
Next up, we have the slumpy psoas activator. And this is a technique that I love for getting this muscle, the psoas muscle, activated again in the position that it's shut off. When we're sitting, this muscle, because especially we're sitting like this on our sacrum, we're rounded, this muscle shuts off. And it's so important for low back pain because it provides lumbar stability, and for hip function because it contributes to centration of the hip joint whenever you're moving your leg up and down. Maintain a strong pressure, and that will activate the psoas in one of its core functions, lumbar. Foot off the ground, hand on the knee, press, and then extend to get into good, tall posture, good alignment, and maintain good, strong pressure to get that psoas activated nice and strong. Now, one little tweak, if you feel like you're getting a muscle called the TFL, which is just on the outside of the psoas, so a little more lateral, if that muscle is working too hard, one little tweak you can do is you set up the same, slouchy, lift the foot, hand on the knee, just externally rotate the hip a little bit and just abduct, bring the knee out just a touch. And from there, do the same thing. Pressure, and then extend, get tall, and then really think about sucking the leg into your body this way. So I'm not only pressing up, but I'm also sucking the leg into the socket to optimize the alignment there and get the psoas fired up. For this exercise, do 1 to 2 sets, 5 reps, holding for 5 seconds on each, and we're good to go. That's of course where I go really deep into this exercise and 7 other techniques so that you can get pointing straight ahead. So don't let your feet point out at all. Bend the knees very slightly and start off in a little bit of an anterior pelvic tilt. So stick your butt out, slight lumbar extension. Not hyperextended, but just a slight lumbar extension. From here, you're going to hinge, so a hip hinge, keeping neutral spine. Once you get to the end range where you feel like your hamstrings have tightened up, you stay there and then slowly activate the quads until the knee is straight. Hold it for a couple seconds and then keeping the quads on, return. Do that on the other side. Slowly activate the quads, straighten the knee, hold it for 2, keep the quads on as you return, and then come back up. We'll do that again. So knees are slightly bent. You're going to hinge over until you get to the end range of motion, maintaining the neutral spine. Activate the psoas to get you down there, to keep that anterior pelvic tilt, and extend the knee, hold it for 2. Extend the other knee, hold it for 2. That's my ankle snapping. Not sure if you heard that. And then you come up. Now this exercise was pretty cool to see when I was researching before doing this video. Really beneficial for these reasons and more. We're not going to get into it all, but if you're going to master one technique out of this video, I would say maybe master this one. In terms of reps and sets, do 1 to 2 sets for Doc. Demonstrate this one. You're going to get into a split stance. Yep, just comfortable split stance, and then within your current level of mobility and strength, you're just going to lower down. If you can get your knee to the ground, you do that. If not, no big deal. And then you come back up. You maintain that position, and then you repeat for, could be 4 to 6 reps, and then you switch sides. Now, a couple of key things to remember: good alignment through the spine, so good posture. The front leg, you want to make sure that foot is flat, heels on the ground, and metatarsal pressure. We talk about that a lot. If you look up any foot and ankle videos on the channel here, you'll hear us describe. Or a bar or something, a chair, a wall, you could use, grab on TRX, whatever it is you got. Have your child who's at the right height and just put your hand on his head and go down. Tell him not to move. But that, you can put some force there, deload it a little bit. And that might help you get a little more range. And we want that range because at the bottom, that's when you get good length through the hip flexors and the quads and rectus femoris in particular. And all the exercise. There you have our 5 exercise routine